options. And I call on Nicola Sturgeon, First Minister.
Thank you, Presiding Officer. Before turning to COVID today, and with your permission, I'd like to give a very brief update on our efforts to welcome refugees from Ukraine. The response of the public across the UK in offering support has been truly outstanding, and I want to thank everyone who has volunteered. Under the UK scheme, though, with the exception of people who already know someone seeking refuge, it may be some time before most of those offering help will be able to actually welcome someone from Ukraine. The Scottish Government's super sponsor proposal is intended to short-circuit this and allow Ukrainians to get here and be safeguarded and supported more quickly. I'm therefore pleased to advise that the UK Government has now indicated support for this proposal in principle and has committed to working with us towards its immediate launch alongside the wider UK scheme. This is a positive development, and I hope, assuming we can agree the details, that as a start it will allow Scotland to welcome 3,000 Ukrainians to Scotland very soon. I will update Parliament more fully on these matters tomorrow. Presiding Officer, turning now to COVID, I will confirm Cabinet's decisions on lifting the limited measures that remain in law and set out our intentions for the testing programme. Firstly, though, a brief overview of the state of the pandemic. Public Health Scotland has had server problems over the past 24 hours, so no daily figures were published yesterday, and of course figures are no longer published at weekends. The case number being reported today, therefore, 38,770, is a cumulative total for the past 4 days. For context, the total for the equivalent 4-day period last week was 36,051. These figures reflect the recent increase in cases. The ONS survey suggests that in the week to 6 March, 1 in 18 people in Scotland had COVID. 3 weeks ago, an average of 6,900 new cases a day were being reported. The average now is just over 12,000 a day. There's also been a rise in the number of people who are in hospital with COVID. 3 weeks ago, that stood at 1,060. Today, it is 1,996. The increase in cases over the past 3 weeks has been driven by the BA2 sub-lineage of the Omicron variant, which is estimated to be significantly more transmissible, with a growth rate since mid-February perhaps 80% greater than original Omicron. BA2 is now in Scotland our dominant strain, accounting for more than 80% of all reported cases. BA2 has become dominant in Scotland earlier than in England and Wales, hence the more rapid increase in cases here than south of the border in recent weeks, although cases and hospital admissions are now rising sharply again in England too. Encouragingly, there is no evidence that BA2 causes more severe illness than BA1 or that it is more effective at evading natural or vaccine immunity. Indeed, immune protection means that the recent rise in cases and hospital admissions has not translated into a commensurate increase in cases of severe illness requiring intensive care. In other words, even though weight of numbers of infections is putting significant pressure on hospital capacity, which is a real concern, we do continue to observe strong evidence that the link between infection and serious health harm has weakened considerably. However, it is likely that this is due to immune protection, not least from vaccines, more than it is to Omicron being inherently milder. That is borne out by current experience in Hong Kong, where relatively low rates of vaccination, particularly in the older population, mean that Omicron is causing very significant levels of severe illness and death there. This, therefore, underlines the continued vital importance of vaccination. So if you haven't yet had doses that you are eligible for, please do get them now. Extension of the programme is ongoing in line with JCVI advice. Letters inviting 5 to 11-year-olds not in higher risk groups for vaccination started arriving at the end of last week, and first vaccinations are scheduled for Saturday. Additional booster jags for older adults in care homes started last week, and appointments will start next week for everyone aged 75 and over. Additional boosters for those who are immunosuppressed will start from mid-April. I know people who are immunosuppressed, and indeed others on the highest risk list, are concerned about high case rates at a time when regulations are being eased. It is important to stress, therefore, that very significant protection is provided by vaccination. Presiding Officer, the higher transmissibility of Omicron does pose challenges. However, protection from vaccines and also the increasing availability of effective COVID treatments are also important factors. Using the approach set out in our revised strategic framework and based on clinical advice, our assessment is that the virus continues to present a medium threat. However, we remain optimistic that it will move from medium to low over spring. As a result, we consider that the overall transition signalled in the strategic framework remains. We should and will continue the transition from legal requirements to advice and guidance instead. Therefore, I can confirm firstly that from Friday, and in line with other UK nations, all remaining COVID-related travel restrictions will be lifted. While we do have some concerns about this, UK travel patterns mean that diverging from the rest of the UK would cause economic disadvantage without delivering any meaningful public health benefit. We do, of course, retain the ability to reintroduce measures if, for example, a new variant emerges. Then, secondly, from next Monday, 21st March, with one temporary precautionary exception, the remaining domestic legal measures will be lifted and replaced with appropriate guidance. That means on Monday, the requirement on businesses and service providers to retain customer contact details will end, and so too will the requirement for businesses, places of worship and service providers to have regard to Scottish Government guidance on COVID and to take reasonably practical measures set out in the guidance. The exception relates to the requirement to wear face coverings on public transport and in certain indoor settings. Given the current spike in case numbers, we consider it prudent to retain this requirement in regulation for a further short period. I know this will be disappointing for businesses and service providers such as daycare services. However, ensuring maximum continued use of face coverings will provide some additional protection, particularly for the most vulnerable, at a time when the risk of infection is very high, and it may help us get over this spike more quickly. We will review it again in 2 weeks before the Easter recess, and our expectation now is that this regulation will convert to guidance in early April. The other issue I want to cover today is testing. Regrettably, our freedom of manoeuvre here is severely limited by the fact that our funding is determined by UK Government decisions taken for England. However, we have sought as far as we can to reach the right decisions for Scotland. It is important to note that we are aiming for the same long-term position as England on testing. However, we consider that the transition should be longer. In England, testing for people without symptoms ended in mid-February and will do so at the end of this month for those with symptoms. We intend the transition to last until the end of April. This is as far as we can go within funding constraints, but this does allow us to take account of current case numbers and better support the shift in our management of the virus overall. A paper has been published on the Scottish Government website setting out the detail. However, in summary, for the next month until Easter, there will be no change to our testing advice. If you don't have symptoms, you should continue for now to use a lateral flow test twice weekly, daily for 7 days if you're a close contact of a positive case and before visiting someone who is vulnerable. If you have symptoms, you should continue to get a PCR test either at a testing site or by post. However, following the Easter weekend from 18th April, we will no longer advise people without symptoms to test twice weekly. With the exception of health and care settings, the advice to test regularly will also end from 18th April for workplaces and for early learning and childcare settings, mainstream and special schools and universities and colleges. However, until the end of April, we will continue to advise using LFTs daily for 7 days if a close contact and on each occasion when visiting a hospital or a care home. And until the end of April, we will continue to advise those with symptoms to get a PCR test. Contact tracing of positive cases will also continue until the end of April. PCR test sites will remain open during this period, though opening hours and locations may change during the transition. Presiding Officer, though, as with all measures, we will keep it under review, our intention is that from the end of April, all routine population-wide testing will end, including for those who have symptoms. Contact tracing will end at this point too, although people with symptoms of respiratory illness will be advised to stay at home. Physical test sites will close at the end of April, although mobile testing units and lab capacity will be retained for our longer-term testing purposes. We will do everything we can to support those who have worked on the testing programme during the transition, and I want to thank all of them for their invaluable contribution over the past 2 years. From the 1st of May, in place of population-wide approach, we will use testing on a targeted basis to support clinical care and treatment and protect higher-risk settings, and also for surveillance, outbreak management and responding to significant developments such as a new variant. Let me stress, though, that for any purpose for which we do continue to advise testing, access to tests will in Scotland remain free of charge. Presiding Officer, today does mark steady progress back to normal life and to a more sustainable way of managing this virus. However, while cases are spiking, there is still considerable pressure on the NHS and there is concern amongst the most vulnerable in particular. So I do ask everyone to be patient for a little while longer on face coverings and to continue following all advice on hygiene, ventilation, testing and, of course, vaccination. And let me take the opportunity in concluding to thank everyone again for all their continued efforts.
Thank you. The First Minister will now take questions on the issues raised in her statement. I intend to allow around 20 minutes for questions, after which we'll move on to the next item of business. I'd be grateful if members who wish to ask a question were to press the request to speak buttons now. And I call Douglas Ross.
Thank you very much, Presiding Officer. And can I start by praising the great British public for their welcoming attitude and compassion. We now know that, as of this afternoon, over 100,000 applications have already been lodged to be part of the UK Government's Home for Ukraine initiative. We all agreed in this chamber that more needed to be done in recent days to support those displaced because of this war, and I'm pleased progress is being made. Now is the time for collaboration, and it's encouraging to see that the Scottish Government are positively engaging with the UK Government over their proposals. Turning to the COVID statement, over 2 years ago, our lives were turned upside down by COVID. The pandemic has had a dramatic effect on all of us. We've all had to make sacrifices. We've all lost loved ones to this virus. We've all changed our way of life. COVID has not gone away, but we have learned to live with it. The UK's world-leading vaccination scheme has been a game-changer, allowing us to move on and get back to normality. It's many of us would like, but COVID cases were always going to rise as restrictions were eased. We can't get complacent with COVID, but we have to move forward. We can't stay stuck with COVID rules forever. That's why it will be a blow for households and businesses that the First Minister has decided to keep the face mask rules in place. The Government said last month these would be removed on the 21st of March, but now that's been delayed. Why won't the First Minister trust the Scottish public to take the steps they think are right to protect themselves and their families? And why are we back to this wait-and-see approach again with no firm date to allow businesses and the public to plan ahead? The First Minister said she will report to Parliament again before the Easter recess, but there is no guarantee that a positive announcement will be made then. So can the First Minister tell us what criteria her government is basing this decision on, and what will need to change for this face mask restriction to be removed at the next review? Finally, the First Minister is proposing continuing to provide testing kits for the whole population well into April. This does not come without significant costs. Funding that could be used to support our frontline NHS workers to tackle the backlog in routine treatments. So can the First Minister tell us exactly how much this extension of free testing will cost here in Scotland?
First Minister.
Firstly, Presiding Officer, Scotland is not stuck. Let me just remind the Chamber and indeed all of Scotland that as of Monday, every single legal measure to help us control COVID will have been lifted, with a limited temporary exception for a continued requirement to wear face coverings. Now, given the spike we're seeing in cases right now and the very high risk of infection, this helps us protect each other, and in particular during this spike, it helps us to protect the most vulnerable in our communities. And I think it will help us get this spike under control more quickly than might otherwise be the case. And I think that's very much in the spirit of solidarity and mutual concern for each other that has characterised the public response to this pandemic over the past 2 years. And I think people in Scotland will actually, in light of very high cases right now, welcome this precautionary move. And even those who may not welcome it, and there will be those I understand in that category, I think will nevertheless be accepting of that and understand the reasons for it. I will update Parliament again in 2 weeks. That's before the Easter recess. I would hope then, and the expectation that we would convert this regulation to guidance in the early part of April. The 4th of April, of course, being the first Monday, and that would be the expectation. But I think it's right to take this approach. How we will make that decision is set out in the strategic framework that we published 3 weeks ago. In short, though, we will want to see this increase in cases stabilise. We will want to see that risk of infection at 1 in 18, according to the ONS in the most recent week, start to reduce, so that particularly the most vulnerable in our society are not at the risk that they are right now. But let me remind everybody, this will be the only legal measure that remains in place, and it will be in place for a short 2-week period of time. On testing, I've got news for Douglas Ross that we'll have to fund now all of our continued testing requirement, including the more proportionate targeted testing system that will be in place for longer term, because the consequentials are not continuing. And these decisions, of course, are driven by the situation that the UK Government arrives at for England. We will continue to assess the overall cost of testing over the next period. If the Conservatives want to listen to my answer.
Colleagues, can I just ask for quiet across the chamber so that we can hear questions and answers?
The overall cost will depend on factors such as outbreaks. It will depend on whether or not we see any new variants emerging, and we will have to flex that cost based on the reality of the situation. The cost of extending prudently for a period access to LFTs, and unlike the situation south of the border, making sure that where we are advising testing, it is free of charge for people who need to test, will be a relatively small part of that overall annual cost. And we will continue to judge that cost based on the circumstances that prevail with the pandemic at any given time.
Jackie Bailey.
The number of COVID cases is rising, hospitalisations are at their highest point since February 2021, health boards are raising concerns about capacity, and I understand that the Queen Elizabeth University Hospital was very close to declaring a code black last Thursday. All 3 NHS Lanarkshire hospitals are reportedly overwhelmed, and staff absence. Health staff groups that will be targeted. Key to our ability to return to normal, of course, is the use of antiviral medication, and I am pleased that testing remains for those who are immunosuppressed. But there are reports that antivirals are not being administered currently in the 5-day window for them to be effective, and some eligible patients are not being offered antivirals at all. One contacted their GP, but the GP had no supplies, no ability to prescribe. The 5 days passed without her receiving the antiviral medication that would have lessened the impact of COVID on someone with a serious underlying health condition. Providing assurance to those with underlying health conditions becomes all the more important as restrictions are lifted. So can the First Minister advise what action is being taken to improve the administration of antiviral medication so that everyone is protected? How much is currently being administered in Scotland, whether there are sufficient supplies, and finally, whether it will now be done by GPs?
First Minister.
Firstly, it is our intention that health and care workers will be advised to continue testing after the end of April. That is likely to at least initially be on a twice-weekly basis, although that will be kept under regular clinical review. But as I said in my statement, one of the purposes for testing after the end of April will be protection of high-risk settings, and that will include, of course, hospitals and care homes. In terms of antivirals, the NHS is working hard to ensure that those who are eligible for antiviral treatment get access to that. I can't comment on individual cases, but if detail is sent to me, I'm happy to have that looked at. The availability of antiviral treatment is continuing to develop and increase, and therefore the eligibility of people to be treated with antivirals will also increase. And again, that will be kept under very close review. The 5-day window is important. Obviously, that's why we have been continuing to support will be to ensure that firm diagnosis can be given for those who may be eligible for antiviral treatment. But that is not going to be a fixed group of people. As time passes, it will be an increasing group of people as availability and effectiveness of these treatments continue to increase. And we will continue to ensure that the health service is working in a way that best supports, as that develops, the quickest and most effective access to those treatments. And the Health Secretary, I'm sure, would be happy to provide more information as access to this scheme and the scope of this scheme widens in the weeks and months to come.
Michael Hamilton.
Presiding Officer, it will be disheartening